Well, good afternoon, everyone, and welcome to our webinar, Streamlining Diabetes Care, Enhancing Workflow, Patient Outcomes, and Revenue with Remote Patient Monitoring. I am Dr. Patrice Little, founder of NP Student Magazine, and I'll be serving as your moderator for this afternoon and thrilled to serve for you today. This session is designed to explore how innovative solutions like remote patient monitoring, specifically continuous glucose monitoring, are transforming diabetes care. We'll dive into strategies for improving workflow efficiency, optimizing patient outcomes, and driving revenue growth for you as healthcare providers and support staff. So whether you are a physician, a nurse practitioner, practice manager, or healthcare executive, today's insights will empower you to deliver better care while achieving sustainable business outcomes. So here's what you can expect from today. We'll provide an overview over our discussion, and then you'll hear from our distinguished guest, that is Courtney Richards, CEO of DME Connected. He will share how the platform DME Connected will enhance workflow and patient outcomes. You'll also hear from COO of Quest Health Solutions, Alex Casillas, who will focus on continuous glucose monitoring and revenue potential in diabetes care. And last but not least, you'll hear from Jim Klauder, a registered dietitian and certified diabetes educator, who will highlight 3 important pieces when it comes to diabetes care. And so this webinar will be 45 minutes long, and we will conclude with a 15-minute Q&A session to address your questions. So you can place them in the chat throughout the discussion, and then I will keep track of it for us to ask towards the end. So let's just dive in to the importance of diabetes or remote patient monitoring in diabetes care. As many of you know, managing diabetes is a complex and resource-intensive challenge. Patients require consistent monitoring, timely interventions, and personalized care plan to achieve optimal outcomes. At the same time, healthcare teams face mounting pressure to maximize efficiency and meet financial goals. And one of the things I've experienced as a provider in practice is that they come in for quarterly visits, and there's certain types of metrics that we're supposed to obtain. And of course, if these metrics are not obtained properly, and there is complication of diabetes, that drives up the cost. So ultimately, this is really to cut down on healthcare costs nationally, as well as making sure that you are able to have a smooth care for your patients. So where remote patient monitoring comes in is it offers a proactive approach to care, allowing providers to, 1, keep track of those metrics, such as your A1C and your daily glucose levels in real time. 2, deliver timely interventions to prevent complications. So you receive those alert and you're able to do real-time interventions versus where patients have to wait to be scheduled to be seen. And then ultimately 3, this reduces the hospitalizations, and we want to, of course, above all, make sure we improve their patient satisfaction. In addition to this clinical benefits, RPM can also streamline workflows by automating data collection and analysis. And one of the things, I don't want to go too far, but I have to mention that one of the services that DME Connected will go into explaining is that they have the integration of RPM, but you're able to order supplies such as the continuous glucose monitoring for your patients with ease. And so this is not only going to save time for you as providers and prevent that back and forth, but it also ensures that your patients receive the attention that they need without overwhelming everyone on the team. And finally, with the RPM, it presents an opportunity to boost your revenue, which Alex will go into when he speaks, through reimbursement programs. And of course, ultimately, this also keeps your patient retention. What I've also seen in practice is that when patients feel like they're not receiving the timely care, they will leave you. So they'll divorce you and go to another practice. So all of these things are for those of you who are practice owners, are key elements for sustainability, especially in this evolving landscape. So I'm excited that Courtney is going to tell you about the innovativeness of DME Connected that is going to help you improve your workflows. So Courtney, are you ready to go into a deeper dive with DME Connected?
Yes, thank you. I am ready and always ready. Okay. So my name is Courtney Richards. I am the CEO and founder of DME Connected. And so one of the things I like to point out is that my team and I, we bring together 50 years of experience within the care coordination space. So I say that because this is not our first rodeo. We've been doing this for a long time, right? So a couple years ago, we started DME Connected. It's an online HIPAA compliant B2B platform that actually helps you connect to the right supplier and service provider that can help your patients out at home. So one of the things that we definitely like to point out is that we integrate with your EHR and or your EMR system to include a real seamless workflow, right? So some of the EHR systems that we currently integrated with right now is AdvancedMD, eClinicalWorks, and Epic. So we're currently integrated with those EHR systems. Not saying that without the integration, it won't work. I'm just letting you know that you can sign up online, dmeconnected.com. That's how you create an account with the HIPAA compliant platform. And then we also will speak to you about the integration as well, too. In Q1 of next year, we're going to be adding more EHR systems. Our goal as DME Connected is to integrate with your platform, no matter how small or large your medical practice is. So that's a quick overview of DME Connected. I would like to jump in and show you guys a demo, basically of how the platform look and works. And like what Dr. Patrice mentioned, so Quest Health Solution is one of our partners. So basically, when you place the order for the CGM, the continuous glucose monitor, Quest Health Solution is one of those companies that's in the platform that can help you facilitate that order and take care of your patients. Okay, so I'm going to go ahead and share my screen right now. So this is what we call an omni-channel. And as you can see, it has like an Amazon feel to it. So basically, when you sign up and you get into the account, you could do a general search based off product and services that you need. Right now, we're focusing on the diabetic, right? The CGM and the supplies that the patient need. But we have over hundreds and hundreds of different products that you can find. So that's how you do a general search and based off the patient zip code where the patient resides. Now, within the platform, you'll see different portals that will give you in detail search features that will help you out as well too. One of the most popular thing that we see people use is search by patient's insurance, or you can even search by self-pay. So I'm going to do a quick demo and show you guys. So for example, once you get in the platform and you need to find a CGM, you just type CGM. You enter where the patient actually resides. I'm going to use zip code 30060, and then you click search, right? So when you click search, what it does is that the AI give you a curated list of who the best suppliers is or the service providers within this patient's neighborhood to help out with that order. As you can see, Quest Health Solutions is here, as well as some other provider suppliers that we work with. So you can actually click here and you find out some more information, deep information about Quest, the product and services, more about Quest Health Solutions as a company, hours of operation, general information that you would need. So that's one of the things that you can find when you actually click on the Quest Health Solutions. Now, one of the popular features that I mentioned before is search by patient's insurance, right? So you want to see who would accept the patient's insurance. So in this particular case, I'm going to use Medicare, right? I'm going to use Medicare. I'm going to use CGM, right? Continuous glucose monitor. And I'm going to choose the state of Georgia where I'm at, right? Because we are a nationwide platform that we have suppliers nationwide. So we put in these criteria. This is the patient's criteria. And then you hit search. Once again, it brings up companies that can accept Medicare and help your patients out as well, too. And as you can see, Quest is on the line, one of the choices that appears. Now you can see that it's available in our e-prescribe system. So once you find a company that you're willing to work with, you can actually click one click of a button, you get within the e-prescribe system. And what basically do, you type in CGM, and it's going to ask you which one do you want to order, the Dexcom or the Freestyle Libre. You click Freestyle Libre in this particular example. You hit next. This page right here is the patient's demographics page, right? So if you're really looking at it, it's showing you how to create and select the product, answer the qualifying questions, and select the vendor that you want to send it to. If you are on one of those EHR systems that's integrated with us, you just enter the patient's chart number or the medical record number here, and all the information flows out of the EHR system directly into this screen, so you don't have to do any type of manual entry. So that's one of the great things with our integration that we've worked on. So basically, you select the product, qualifying questions, you select the vendor, and then once you send it to the vendor, it's going to go directly into your dashboard. So from your dashboard, you're going to keep track of every order that you've sent to and what's going on with the status with that supplier as well too. So once the order goes to the supplier, such as Quest, they have two options. One option is to basically review the order and accept it. Once they click accept, a notification will go back to your office and let you know that Quest Health has received the order, they're reviewing it, and they're going to be taking care of it. If they run into any type of difficulties and so forth, they have the option to reject that order, right? So right here with the status, it will let you know basically what's pending. Someone is reviewing it, if they've accepted it, or even if they've rejected it. You also have a chat feature where you can speak directly with the companies that you've referred that patient over to as well too. So what you're looking at is one all-inclusive system where basically from the first screen, you can find a product and service that you're looking for based on different search criteria that's best fit for your patient. And then you can go into the e-prescribe system, create an order, send it over directly to that company, and have back and forth communication with them as well too. So that's just a quick overview. But what it does is that it just streamlines, no more faxing, no more Google searches, no more phone calls. These are all things that's just tying down your medical team when it comes time to ordering equipment and supplies for your patients. So I'm going to pass it along over to Alex and his team as well too, because once the order get to them, then you'll be able to see what their workflow process is and how do they work with your patients to make sure they're taken care of. Alex?
Perfect. Thanks, Courtney.
Yes.
So a little bit about Quest before we jump into the workflow. So Quest has been around since 2019, and we're a nationwide company and a supplier of CGM, focusing on the Libre and the Dexcom, like Courtney mentioned earlier. We have a coveted relationship with Abbott. So we're one of 15 authorized suppliers with Abbott. That allows us access to certain products and resources that other suppliers do not have access to, which is awesome. And it gives us that credibility in what we do. We accept several insurances. We specialize in Medicare. That's the bulk of our patient base, but we accept many insurances because we have an in-house team of insurance verifiers. So all of these services that we provide, which I'll get into, are in the spirit of helping the provider with certain pain points that exist within the provider's workflow and practice, as well as supplying patients in the most efficient way possible with the devices and resources that they need. So we understood all of those different pain points in the ecosystem, and we took it upon ourselves to say, all right, if we're building a company that is going to support this ecosystem, let's start out first by solving these pain points. And then we also are a self-proclaimed tech-forward company. So we try to find the ways to automate and just take us into the 21st century. With the way we conduct business. And that alone also helps providers in their workflow. It's amazing that in 2024, we're still faxing. And sometimes providers just stick to the common way and the familiar way to do things. And what we add with our account managers is the support in helping providers improve their workflow as well. We understand the workload that takes place on the day-to-day within a provider's practice. And that's what we assign our team members to do. Not only conduct the transaction, but understand what those pain points are and develop solutions and support those solutions like DME Connected within the provider's workflow. So we train our team members on these e-prescribed platforms, not only from the supplier point of view, but from the provider's point of view. So we can help walk you through when we're on the phone working with a mutual patient on getting those supplies. We can understand from the provider's point of view exactly how to get through those technological resources in the most efficient way possible. So we serve as an extension of your practice. And I know that's uncommon to hear from a supplier because most of the industry is very transactional. And we focus on being experiential. And you'll hear that throughout our conversation today. So that's a little bit about us. Now, piggybacking off of what Courtney mentioned about the workflow. So when you send an order to us, we have a direct link into our own portal. So we have the supplier side of the portal. And Courtney, I don't know if you're going to go through a demo of the supplier side.
Yes, I'll go ahead and do it. Once you
Okay, perfect. So on the supplier side, our team members get notified once there's an order submitted. And immediately, whether it's email or if they have the portal open, they can take a quick action of accepting or rejecting the order. So as a provider, you're submitting not only the order, but the accompanying documentation. So our account managers quickly access that documentation and can make a quick discernment of, one, do we accept the insurance? Is this the state that we service? There are 2 states in the US that we don't service, which is Montana and North Dakota. But we service the rest of the US. So we can do a quick qualification based on that documentation and make a decision whether to accept or reject. If it's something simple that's missing, which is very rare because the DME Connected platform walks the provider through exactly what is needed. So the error is minimal to none when you're submitting an order. But in the unfortunate case, if there is something that is needed, we can chat with the provider directly through the DME Connected portal. So all of our team members are trained on that in order to get what we need quickly and efficiently. So once that order is accepted, then it goes through our qualification process. So we have a team of verifiers, like I mentioned before, insurance verification. So if there's a commercial insurance that a patient has, we take the steps of reaching out to that payer and just understand that patient's plan a little bit deeper and see if they qualify for a CGM. Once that qualification is approved, it moves down the line to clinical qualifications. So we review the medical record and ensure based on the insurance. So Medicare has a set of requirements, and then commercial payers sometimes have either the same requirements, so they meet Medicare guidelines, or they have an added set of requirements. So through that insurance verification process, we identify it, and then the clinical verification process, we qualify it. To make sure those requirements are met. So there's a series of compliant quality assurance functions that we take the account through to ensure that patient is going to get their device and then there are no hiccups after they receive that product. So we do a lot of that legwork that in some practices they traditionally take on. We take that burden off of those providers to do that. So the insurance verification process, the medical record review process, and the document retrieval process in the instances where we need to retrieve certain documentation. Nevertheless, we still meet the providers where they're at. So I know Courtney is doing the work in the field to get as many providers on DME Connected as possible. And sometimes the adoption rate is low because providers still choose to fax. And we meet those providers where they're at. So we still accept faxes as well. And that's where our account managers communicate with the providers to say, all right, we'll accept this fax, but hey, do you know about DME Connected? And there's an easier way to send this documentation. And the reason I mention that is sometimes we delay the process in getting the patient what they need, because if we receive a fax and it's missing a signature, or there was an edit made to the prescription and the provider forgets to sign and date it, that sometimes adds 24 hours, 48 hours to the process in getting the patient what they need, which is why e-prescribe is so essential in injecting that and implementing that in the provider's practice. So, we definitely support the adoption of e-prescribe. It helps us in our practice and our workflow. So we encourage all providers to adopt some form of e-prescribe platform within their practice, and they'll understand how much of a burden it lifts when you include that innovation within your practice.
Okay. And so what I would like to do is go ahead and jump into a demo and to show you exactly what the supplier's account look like when they actually receive an order from DME Connected. And I would like to piggyback what Alex is saying is one of the things that we did mention that, you know, DME Connected is no cost for your medical practice as well too. There's no cost. You simply sign up. It's a HIPAA compliant platform. You could start using it today, right? So I'm going to go ahead and share my screen, and I'm going to show you what an account would look like for a company like Quest. So basically, it would show them how many orders they have in their buckets. When an order first goes to them, it goes into the pending bucket or the accepted bucket. And these are the two main functions that they can do once they receive an order. So from their particular screen, they will click here and they will see how many orders they have in pending, right? So the first thing they would do, like what Alex mentioned, is that they would actually look at their electronic prescription, right, which is created within DME Connected. They would highlight this and it will show them everything that they need to know about the patient. Of course, this is a test patient, but this will basically have the patient name, the date of birth, the diagnosis. These are all the questions that's being answered on a medical provider standpoint when they're answering these questions. What physician is signing the order as well? Is electronically signed and dated when the order was created? And then the clinical questions that would help that provider to be able to take care of that order as well too. So once they review that, they have the option to accept it, which they will basically just click accept and click OK. And once they accept it, then an email notification goes back to the medical provider's office and lets you know that they have reviewed the order and they're accepting it. If they notice something that's wrong or they're trying to reach out to the patient, whatever difficulties that they're going through or challenges or questions that they may have on the order, they can either hit reject or they can even chat directly with your practice as well when you're in DME Connected. So they'll be able to chat in here, let you know what's going on with the patient, answer any questions. If there was anything missing from the order, you as the medical provider on your chat feature, you can attach it here and send it to them directly as well. So keep in mind that this is all HIPAA compliant as well too, right? So they have the order, they accepted it, then it goes directly into their accepted bucket. From their accepted bucket, they'll be able to download the clinical files that you, the medical provider, has attached to, and then they'll take it from there as well too. Within their dashboard, they do have the function to be able to see orders that they have rejected as time went by. So from an operational standpoint, if it's an insurance that they're out of network and they're seeing that they're receiving a lot of those, maybe they want to reach out to that insurance and get in network with them. Or maybe if there's something that needs to be, you know, on an education standpoint, speak with the medical providers about, then they can do that as well too. But this is how it would basically look on the supplier's standpoint, where they will see orders that coming in, they can accept it or they can reject it. And then I'll go ahead and pass it back along to you, Alex. Give us an example of basically when an order is rejected. What is your next steps from there? What do you guys usually do?
So if an order is rejected, what we call is voided. So we'll
Yes.
void an order. Some typical voids are usually insurance related. If it's an insurance that is unaccepted, or insurance we accept, however, the patient's plan specifically has a setup with deductibles or copay that's too expensive that the patient doesn't want to pay, then we'll void that order and we communicate back with the practice. So that's where the chat feature comes into play, or the reject feature, where we can simply notate what occurred, and then that information goes directly back. Today, outside of DME Connected, we'll call the provider. We'll also fax them because we have automation. Once again, we're a tech-forward company. So any voids are automatically faxed back to the provider with a notice as to why it was voided. But we also extend, where time permits, a call to the provider as well. You mentioned something about education, and that's a big component with the changes in the last year, you know, the public health emergency. It ended officially in November. A lot of changes happened in May with the public health emergency ending. And then in November, they allowed a ramp up time into November of 2023 for any grandfathered patients that met the public health emergency guidelines to continue getting service. And then as a supplier, we needed to make our adjustments all the way through November of 2023. A lot of providers were unaware of those changes. So took the time to educate them during that May to November period. And using a tool like DME Connected, it makes it a lot easier. So when we see we're receiving orders after November and they're still following PHE guidelines, we know that's a provider that needs a little bit more of an educational or a refresher on some of the changes. And once again, we understand how busy it is for a provider in their practice, and then to keep up with all of these regulatory changes, it's like an act of Congress. So we're there because as a supplier, November was really a big reset for the industry. So we got ahead of that by just understanding the regulation, obviously, and then working with our providers on educating them of the changes as the months ensued. And to use the e-prescribe platforms like DME Connected for that communication, chatting with them or using it simply as a guide, looking at the rejected bucket and say, okay, why were all of these rejected? Anything clinical, we know there's an educational there. So we utilize that as our, as our tool.
And DME Connected work with their suppliers to make sure we have the latest and greatest requirements, on the product that you're offering. So from a compliance standpoint, orders that's going directly through DME Connected, you're getting a clean and accurate order most of the time, right? And that's really important because like what Alex said, we've been in situations where, document chasing is just going back and forth. Something is missing, something needs to be addressed. But by using a company such as DME Connected, that's why we're saying we're streamlining this process, right? And it's simple, easy to use. If you could use Amazon, you can use DME Connected, right? Alex, now once an order is accepted and you guys have gotten this out to the patient is educated, got the equipment. Speak to us a little bit more about how does that flow directly into remote patient monitoring, what it is, and what should the providers expect from that?
Absolutely. So once a successful order of an order is successfully fulfilled, one, we communicate with that provider. So the same automated means. So a fax goes to the provider saying, hey, congratulations, we were able to fulfill this patient. And then we also follow up with a phone call to that provider, educating them and updating them. So one, educating them on what to expect next for that patient. With CGMs, every 6 months, there has to be an updated progress note on file. So we take the added measure of just communicating with the provider, the status, and say, hey, provider, we took care of patient Jane Doe. Just to let you know, we will be reaching out to you within the next 6 months for updated progress notes to keep Jane Doe on service. So we have an automated resupply process, which is also an added benefit to a provider. So patients don't have to go to the provider. They don't have to go to the pharmacy. We handle the resupply process for the patient as long as they're in good standing with updated notes. And if they change their insurance, they let us know so we can run the eligibility on that change and see if they still qualify. If all checks align, then we keep that patient on service for as long as we can. Now, the RPM piece is an added component, like I mentioned in the beginning. Everything we're talking about up until that point is transactional, right? We add the layer of experience by communicating with the provider, letting the patient know where they stand in the process until they get their order, and then the added step of the automated resupply. So the patient doesn't have to inconvenience themselves in getting their order. They know when to expect it and how often. Now the RPM component is an added layer of care to ensure the patient is following their diabetic regimen and they truly understand the condition that they're working with and the best way to manage that. And that's where Jim comes in. I'm still learning from what Jim is sharing with us on best practices around diabetic management. And Jim, if you can pick up from there and talk about what the RPM process is from a patient's point of view and what the patient can expect, and then what the provider can expect by implementing such a program in their practice.
Absolutely. So everyone, my name is Jim Klauder. I'm a dietitian, certified diabetes care and education specialist. I've been in the field for over 5 years now. My whole career has been in diabetes from day one. Really passionate about the topic. It's a really important thing. That's why we're all here. So I think some background to RPM as a whole is important to kind of talk about what it is in kind of traditional practice, right? So traditional RPM, you go to your doctor's office, Dr. Smith, and he says, hey, we need to put you on remote patient monitoring. And really what that entails is they provide you with a device that will automatically upload information to that doctor's platform. And a medical assistant or some member of somebody in their office will be calling you once a month to check in with you, review the data with you, escalate problems as needed. So what I just described makes a lot of sense for like an in-person environment, right? Where you see your doctor in person, they have something in their office, but you can already start to see some of the labor demands of that, right? Where you need to have a dedicated member in your office to be reviewing all this data coming in, reaching out to patients as necessary. Not every office has that kind of labor available. I've worked in a lot of different healthcare settings, and in almost all of them, we're trying to find MAs, we're trying to find techs, we're trying to find nursing assistants that are top quality to help us out. So where we come in at Quest is we take that and offer it as a service where we can partner with a provider's office and we do the remote patient monitoring for them. So within our platform, right, we provide CGMs. So we can monitor using a CGM. We get the AGP report once every 2 weeks, or actually with our new platform, it's more like once a week. We call the patient, we review the whole thing with them, which is so important because so often patients don't understand what these numbers mean, right? They go see their doctor, we throw things at them, and they don't always grasp exactly what it means to be in range, what a low actually is and how to treat it. So from the comfort of the home, we're calling them, reviewing this data with them, explaining it to them, answering their questions, and really importantly, helping to give them tips, general advice, nothing too serious that would alter their treatment, but saying, hey, it looks like your blood sugar is going high at dinner every day. What are you eating? Oh, you're eating that? Can we provide you with a handout? Can we review some healthy eating tips with you that are standard from the American Diabetes Association? So what's so great about our RPM program is we take this awesome service that is remote patient monitoring and we make it available to way more providers and thus way more patients. So from my perspective as a clinician, I'm a huge fan of it because when I was seeing patients in outpatient, I'd see them once every 3 months, right? Whatever I say to them is probably forgotten by the time I see them again, especially if it's nutrition counseling. But here we have the ability to call once a month. We have the ability to call once every week if they really want that. So I've covered the CGM, and we also do blood glucose monitors too. So that one is a little less detailed than a CGM, but we can still use the monitors we use have a SIM card in them. So they take their blood glucose, it automatically uploads for us, which helps prevent the dreaded word of logbooks, right? How many patients actually bring their logbook to your appointment? Not very much, right? But now we can take that, all the stuff that's already being automatically sent to us, summarize it, put in a table for you, send it to your practice with some breakdowns of what it looks like. So it's really just a great way to, Alex mentioned, taking things into the 21st century to help do that, right? To help take all this awesome data that we have, especially in a disease like diabetes management, where we're so blessed to be caring for a disease that has all these tools and use them in their most efficient means.
Gotcha. And that's great, and that's one of the things why we partnered with Quest Health Solutions, right? Because if you think about streamlining from the initial part where the physician or the medical team places the order in DME Connected, then it goes directly to Quest Health Solutions. You guys provide the actual devices, get it delivered, the education to the patient, and then from there, you're even taking a step further to do the remote patient monitoring. And this is an ongoing journey, right? Because diabetes, it's a journey. It's not a transactional thing like what Al said previously, right? So I'll pass it along back to Dr. Patrice now. I know she wants to open it up for questions and answers.
Yes, and thank you again, Courtney, for the overview on DME Connected, and Alex on sharing how Quest Health Solutions is innovating continuous glucose monitoring. It's good to know how the two platforms are integrated. I do want to shift to diabetes care and ask Jim just a couple more questions regarding your expertise. Particularly when it comes to the education of providers, because many of us do not receive training on the CGM. while we're in school. And so once these devices have been prescribed, usually there's that gap. And wanted to know if you can share the strategies on what you do at Quest that uses to educate the patient on the CGM and how you can help them seamlessly integrate it into their lives.
So I can speak, Jim, if you want to talk about the RPM part, but really briefly, I can speak to the Quest component.
Okay.
And Dr. Patrice, let me know if you're going to share the provider guide. I shared a provider guide that I think is going to go out to all attendees on how to successfully prescribe a CGM. And within there is an educational around the differences in each of the devices. So you have a comparison chart that shows you the Dexcom G6 versus the G7, the Libre 2 versus the Libre 3, and then comparing the Libre versus the Dexcom as well. So we provide that, once again, in the spirit of education. We provide that to our provider demographic. And then Jim can talk about how he educates providers from the RPM component.
And just to clarify, Dr. Patrice, you want me to talk about how we educate providers on utilizing this tool? Okay, sure. So that's a great point that you bring up, which is that most providers have a lot more to care about than just diabetes, right? And it seems like in even just the time I've been in the field, things have already progressed so much that when I talk to doctors, they're still bringing up things that are 3 years ago. And in diabetes world, 3 years is essentially 20. So we do a few things. The first thing is whenever we need to escalate with patients, we personally make an outreach to a doctor, to the office themselves. So for example, if I notice a patient spends more than, this actually happened last week, but we had a patient spend more than 40% of their time in the very high range, which means 40% of the time they had the CGM on, their blood glucose was above 240 or 250. And so I called the office, I explained this to them, and they said, okay, well, what were their blood sugars? And I said, well, that's not really the concern right now. The fact is that they were in this range for a long period of time. So those kinds of touch points give us the opportunity to talk to practices and show them why this technology is so important. So from our perspective, it's through really daily encounters, but also teaching the patients how important this data is too, so that they can interpret it themselves. I had another patient who was going low, right? And their doctor never got the chance to tell them what a low blood sugar actually is and how to take care of it. Or this happens all the time. This happens in every field I've worked in with diabetes. What's a goal range? When I check my blood sugar first thing in the morning, my doctor told me to check it, but I don't know what the number is, 130 or less for most people, above 80. But we get to be that chance. So I like to look at us as like an accessory to the doctor, right? They're making all the treatment decisions. We're just giving them the information, but we're serving as an extension to help fill in the gaps in their extremely busy and hectic schedules, or any treating physician or practitioner.
Thank you for sharing that, Jim, because that also, you highlighted some of the challenges, and that was going to be the second question. So that was, that gives us some more time to open up for the Q&A. Our first question comes from Ken Burgess, who says, I like how you're bringing medical equipment ordering into the 21st century. If a vendor is out of a stock of an item, will you be alerted? And Courtney, could you share that? Can you address
Yes,
that one?
definitely. And that's what the accepted or rejected button is, right? So once they actually receive the order, they have the opportunity to review that order up front, right? See what product the doctor is ordering, what the diagnosis is, what the insurance, what's the coverage area where that patient lives. So these are just some of the things that the vendors will actually look at and say, yes, I have this in stock. I'm going to accept it. So when that physician received that accepted button, they know that it's actually been approved. Someone physically took a look at it, right? And it's ready to go. If there's any situation where they may have reached out to the patient and the patient denies, a lot of different things, or the patient doesn't pick up the phone for 800 numbers, or whatever the case is, within that chat feature, that's what's so important about the back and forth communication as well, too, where you're handling it right within DME Connected. But to answer your immediate question, if they're out of stock, that's what the accepted or rejected button is all about.
Thank you, Courtney. I wanted to know if there were any other questions from our attendees. Okay.
Okay. Well, One of the things that I definitely wanted to point on is basically, and I'll ask it to Quest too, right? Basically, you say you cover the entire United States as well too, right? So, and how long, I would let the audience know how long have you guys been in this space? You know, some organizations that you guys are a part of, because I think that's important for them to know as well too.
Yeah, absolutely. So, we're definitely participants in the ADA. So the American Diabetes Association, we've sponsored, the walks, Step Out for Diabetes walk. So we're active participants there. I mean, we're at all of these different trade shows. So one notable trade show that we're a part of is the ADCES. So we exhibit all the time at that show, for all of our CDEs that are out there. So we support that. We're registered on the Better Business Bureau. We have partnerships throughout the entire industry. I mean, the list is endless in our footprint. Once again, we have that relationship with Abbott, and it's a coveted relationship of one of 15 other suppliers. So that speaks volumes when we're talking to providers, because they know it's a trusted source. So not only are we active within the nonprofit spaces, we are active participants in the private space as well, with good, solid relationships, which is important. We're not competing against our competition, quote unquote. We're sharing in the space and taking care of as many patients as possible. We separate ourselves by the type of service we provide, but in no way, shape, or form are we competing with them. So.
Okay. And just to let the audience know as well too, to sign up to DME Connected, it's just dmeconnected.com. You literally go to dmeconnected.com, you hit log in, it will bring you to a registration screen. Once you register, you get into the platform right away. We see who you are, and then we'll give you an exclusive gold account, pretty much, where you can do everything within the platform. And from there, you can find the service providers that you need to work with, send the orders directly to them even today, right? So that's how you get access to dmeconnected.com. If you'd like to get in contact with Quest, Alex, what's your contact info?
It's Alex at Quest Health Solutions.
Mhm.
So very easy.
And it's questhealthsolutions.com, the website?
Correct.
Gotcha. Do you
So
have any other?
Courtney and Alex, we do have a couple more questions. So that's great. As you guys speak more, it stimulates the audience for more questions. One question says, do you provide resources / equipment for those that don't meet medical criteria for a prescribed CGM? For instance, CGMs usually require a person to be prescribed insulin. What about patients with type 2 diabetes who do not take insulin, but may want to monitor their levels without daily finger sticks?
Oh, wonderful question. So that goes to the educational component, right? So during the PHE last year, Medicare or CMS relaxed some of the requirements. And then upon the end of the PHE, they revised the requirements. So now the qualifications are, you have a diabetic diagnosis and you're insulin treated or non-insulin treated, but have experienced a level 2 or 2 or more level 2 hypoglycemic events or 1 level 3 hypoglycemic event. So now insulin treated or non-insulin treated patients can get the service that they need if they meet the qualifying criteria. So those are one of the questions that if we were to come across, DME Connected, we would see that and say, okay, this seems like a provider that needs to get updated on the criteria or the requirements, starting with Medicare requirements. Commercial insurances vary, but once again, Medicare is that benchmark. And then commercial insurances can be a little less stringent if they want to be. That's very rarely the case. So we use Medicare as that standard because that's what we commonly see in the field.
Thank you, Alex. Courtney, I'm going to direct this next question to you. How many suppliers are currently on DME Connected?
We have, I say hundreds, but we have over 400 suppliers that can help address, and these are nationwide as well too. So just to let you know, it's not all. So we started out with durable medical equipment. We quickly found that, providers needed more help in other areas. So not only is it DME equipment, durable medical equipment, but it's also home health within our platform, non-clinical services as well too. If the provider needs to refer a patient for any type of behavioral, mental health, or drug and alcohol, substance abuse centers, they're in the platform as well too. So we want to be one centralized place that's going to be a resource for that medical provider. So just think about when you need to shop for anything, you go to Amazon and you start shopping, right? That's what DME Connected is, and that's what we're providing to the provider as well too. So yes, it's over 400 different suppliers. They're doing various different product and services. So it's not only ordering a service, but a provider can go and refer a patient over to a drug and alcohol rehabilitation center, and they'll be able to get that reach out to the patient as well too. All right. So hopefully that answered your question.
Thank you. Thank you all for attending, and again, thank you for the response to that question. Special thanks again to, of course, you, Courtney, Alex, and Jim for sharing your expertise and insights on streamlining, not just caring for patients with diabetes, but other types of chronic conditions through your innovative technology, such as the continuous glucose monitoring and remote patient monitoring. As we wrap up, I want to encourage you all who have not already signed up for DME Connected to please visit dmeconnected.com and to schedule a demo as well as Quest Health Solutions, which is questhealthsolutions.com for more information about continuous glucose monitoring and remote patient monitoring. Also, the last thing is that this webinar will also be available for viewing as recording, so feel free to visit dmeconnected.com. It should be, and Courtney, just confirm for me under the video section.
Yeah, it's going to be an event section. This is going to be an ongoing series that we're going to be inviting our partners out, and we're going to be discussing not only diabetes, but respiratory patients as well too, sleep apnea patients, just the different modalities and challenges that we see. We just excited to share that we just signed on another provider with occupational therapist as well too. So this is going to be an ongoing series that's just meant to, empower the providers on basically what DME Connected is, how it helps your workflow, how it's helping your patient outcomes.
And we hope that you all who have attended today will pass on the word about DME Connected and Quest Health Solutions and the different types of innovation that is out there to improve the efficiency in your practice. Again, we hope you found this information very valuable, and we look forward to you joining us for the next webinar next month. So stay tuned to your newsletter and have a wonderful day. And thank you again for your time.
Thank you.
Thank you.
Thanks, everyone.